The silent warning sign of blocked arteries. Most people ignore. What if your body has been warning you about blocked arteries for months or even years and you never noticed? Many people believe a heart attack happens without warning, but that is not always true. Sometimes the body sends quiet signals long before a medical emergency occurs. Missing these silent warnings can change a life forever. Blocked arteries usually develop slowly over many years. During this time, a person may feel perfectly healthy while dangerous changes are happening inside the body. Your arteries are like highways that carry oxygen-rich blood from your heart to every organ in your body. Every heartbeat pushes blood through these important pathways. When arteries become narrow, blood has a harder time reaching the tissues that need it. This reduced blood flow can affect your health long before a heart attack occurs. Blocked arteries usually begin with tiny injuries to the inner lining of the blood vessels. Over time, cholesterol, inflammatory cells, calcium, and other substances collect in these damaged areas. This buildup is called plaque. As plaque grows, the artery becomes narrower and less flexible. One surprising fact is that arteries can become significantly blocked before symptoms appear. The body often creates small alternative blood vessels to help maintain blood flow. This natural adaptation can hide the problem for years. Unfortunately, it also delays diagnosis until the disease becomes more serious. One of the most common silent warning signs is chest discomfort during physical activity or emotional stress. Many people expect severe pain, but the feeling is often much milder. It may feel like pressure, tightness, heaviness, or squeezing in the chest. Because it is not always painful, many people dismiss it as nothing serious. When you exercise or become stressed, your heart works harder and needs more oxygen. Narrow arteries cannot always deliver enough oxygen-rich blood to the heart muscle. This temporary shortage is called ischemia. It can cause chest discomfort that disappears after rest. Not everyone experiences the same symptoms. Some people describe a burning feeling similar to heartburn. Others feel pressure in the chest rather than sharp pain. This is one reason blocked arteries are often mistaken for less serious conditions. Sometimes the warning sign appears somewhere other than the chest. Discomfort may spread to the shoulders, arms, neck, jaw, or upper back. These symptoms happen because nerves from the heart share pathways with other parts of the body. This phenomenon is known as referred pain. Some people never experience noticeable chest discomfort at all. Instead, they feel unusually tired or become short of breath during activities that once felt easy. These subtle changes may be early signs that the heart is not receiving enough blood. Your heart is a powerful pump that sends oxygen-rich blood throughout your body. When the heart muscle receives less oxygen because of narrowed arteries, it cannot pump as efficiently during physical activity. As a result, your lungs work harder to meet your body's oxygen needs. This is why unexplained shortness of breath can sometimes be an important warning sign. Inside a blocked artery, plaque continues to grow little by little over many years. The opening becomes narrower, making it harder for blood to flow smoothly. Think of it like a water pipe that slowly fills with mineral deposits. At first, the flow seems normal, but eventually the restriction becomes significant. Many people think plaque is made only of cholesterol, but it is actually much more complex. It contains cholesterol, inflammatory cells, calcium, fat, and scar-like tissue. These materials build up over time as the body responds to damage inside the artery. This is why heart disease involves both cholesterol and inflammation. The greatest danger is not always a severely narrowed artery. Sometimes a smaller plaque suddenly cracks open. The body reacts by forming a blood clot, which can quickly block blood flow completely. If this happens in a coronary artery, it may trigger a heart attack. Many heart attacks appear to happen without warning, but the underlying disease often develops over decades. A plaque rupture can occur unexpectedly, even if previous symptoms were mild or unnoticed. That is why prevention is much more effective than waiting for symptoms to become severe. Early action can save heart muscle and, in some cases, save lives. High blood pressure puts constant stress on the delicate inner lining of your arteries. Over time, this damage makes it easier for plaque to develop. Many people have high blood pressure without knowing it because it often causes no symptoms. Regular blood pressure checks are one of the simplest ways to protect your heart. Low-density lipoprotein, often called LDL cholesterol, can contribute to plaque buildup when levels remain high over time. Excess LDL particles may enter damaged artery walls and become part of developing plaque. Healthy lifestyle choices and, when appropriate, prescribed medications can help lower this risk. Managing cholesterol is an important part of protecting heart health. Smoking harms nearly every part of the cardiovascular system. Chemicals in tobacco smoke damage blood vessels, increase inflammation, and make blood more likely to clot. Even exposure over many years can significantly raise the risk of blocked arteries. Quitting smoking is one of the most powerful steps a person can take for heart health. High blood sugar can slowly damage blood vessels throughout the body. This damage makes it easier for plaque to develop and harder for arteries to stay healthy. People with diabetes often have a higher risk of heart disease than those without diabetes. Good blood sugar management supports both heart and overall health. Carrying excess body weight, especially around the waist, can increase the risk of blocked arteries. It is often linked with high blood pressure, unhealthy cholesterol levels, and insulin resistance. These conditions place extra strain on the cardiovascular system over time. Even modest, sustainable weight loss can improve several heart health markers. The human body is designed to move. Spending most of the day sitting can contribute to poor circulation and increase the risk of cardiovascular disease. Regular physical activity helps the heart pump more efficiently and supports healthy blood vessels. Even a daily brisk walk can make a meaningful difference over time. Sometimes heart disease runs in families. If your parents or close relatives developed heart disease at a younger age, your own risk may be higher. Genetics cannot be changed, but healthy habits can still lower overall risk. Knowing your family history helps you and your healthcare provider make informed decisions. As we grow older, our arteries naturally become less flexible. Years of exposure to cholesterol, blood pressure, and other risk factors gradually affect the blood vessels. This is one reason the risk of heart disease increases with age. However, healthy choices remain beneficial at every stage of life. Many people dismiss mild chest discomfort because it goes away after resting. They assume it is caused by indigestion, stress, or simply getting older. Unfortunately, ignoring recurring symptoms can delay diagnosis and treatment. Repeated warning signs deserve medical attention, especially if they occur during physical activity. Another common mistake is waiting until symptoms become severe before seeking help. Heart disease often progresses silently, and serious damage may occur before obvious warning signs appear. Early evaluation gives healthcare professionals more options to reduce future risk. Acting sooner is usually better than waiting. Doctors have several tools to evaluate heart health and blood flow. Depending on your symptoms and medical history, they may recommend tests such as an electrocardiogram, a stress test, blood tests, CT coronary calcium scoring, or other imaging studies. No single test is right for everyone. Your healthcare professional chooses the most appropriate evaluation based on your individual situation. A heart-healthy eating pattern supports healthy blood vessels over time. Meals rich in vegetables, fruits, whole grains, legumes, nuts, and healthy fats provide important nutrients and fiber. Limiting foods high in saturated fat, trans fat, added sugars, and excess sodium can also support cardiovascular health. Small, consistent dietary improvements are often easier to maintain than extreme changes. Exercise strengthens the heart much like training strengthens other muscles. Regular movement can help improve circulation, support healthy blood pressure, and improve overall fitness. Activities such as brisk walking, cycling, swimming, or dancing can all contribute to heart health. The key is finding activities you enjoy and can continue long term. Good sleep and effective stress management also play important roles in cardiovascular health. Poor sleep and ongoing stress may contribute to higher blood pressure and other health challenges in some people. One of the smartest ways to protect your heart is to know your health numbers. Regularly checking your blood pressure, cholesterol, blood sugar, and maintaining a healthy body weight can reveal problems long before symptoms appear. These measurements give your healthcare provider valuable information about your cardiovascular risk. Early awareness often leads to earlier action and better long-term outcomes. Many people ask whether blocked arteries can completely disappear. Advanced plaque usually does not simply vanish, but research shows that healthy lifestyle changes and appropriate medical treatment can slow its progression and, in some cases, reduce certain plaque features. These changes also lower the risk of heart attack and stroke. The goal is not only to treat disease but also to prevent future complications. If your healthcare professional prescribes medication, it is important to take it exactly as directed. Medicines such as cholesterol-lowering drugs, blood pressure medications, or other treatments are prescribed based on your individual medical needs. Never stop or change medication without discussing it with your healthcare provider. Combining medication with healthy habits often provides the greatest benefit. Some symptoms require immediate emergency medical care. Chest pain or pressure that lasts for several minutes, severe shortness of breath, sudden sweating, nausea or pain spreading to the arm, neck, jaw, or back may be signs of a heart attack. These symptoms can vary from person to person, especially in women, older adults, and people with diabetes. If you think someone may be having a heart attack, seek emergency medical help immediately. When a heart attack blocks blood flow, heart muscle begins to suffer damage within minutes. The longer treatment is delayed, the greater the risk of permanent injury to the heart. Rapid medical care can restore blood flow and improve outcomes. That is why recognizing symptoms and acting quickly is so important. Imagine a man who notices mild chest tightness every time he climbs stairs. He assumes it is simply because he is getting older and continues to ignore it for several months. After discussing the symptoms with his doctor, tests reveal narrowed coronary arteries, and he begins treatment before a heart attack occurs. This example shows how paying attention to subtle changes can make a meaningful difference. Protecting your heart does not require waiting until tomorrow. Every healthy meal, every walk, every good night's sleep, and every positive choice supports your cardiovascular system. Small improvements repeated consistently often produce meaningful long-term benefits. Prevention is built through everyday habits. If you experience recurring chest discomfort, unexplained shortness of breath, unusual fatigue during activity, or have several risk factors for heart disease, schedule an appointment with a qualified healthcare professional. They can evaluate your symptoms, assess your overall risk, and recommend appropriate testing if needed. Early evaluation provides the best opportunity to identify problems before they become emergencies. Never ignore symptoms that concern you. Your body often whispers before it screams. Learning to recognize subtle warning signs and understanding your personal risk factors can help you make informed decisions about your health. Remember, blocked arteries usually develop over many years, which means there is often time to take preventive action. Caring for your heart today is an investment in your future. If you found this video helpful, please give it a like and share it with your family and friends.